ह्याच हावजांत आनी आख्खे गोंयभर आनी मिनिस्टराकूय खबर आहा दॅट इट हॅज बीन सेड सेवरल टायम्स एंड इन द रिप्लाय इट हॅज बीन शोन that referrals made by the South Goa District Hospital to GMC is increasing, and the total referrals made in the last 4 years, as per the LAQ reply itself, it shows 17,425. While from January to June 2024, it has been shown that it has touched to 2,389. Plus, it is also showing a reply that South Goa District Hospital has transferred 71 patients this year to private hospitals. Because sir, आत इतली हे जायत आहा चर्चा आमकां 2 वरां जालीं. I need a specific answer. आज दी या 7 तारीख ऑगस्ट जाच पयले हावजाचे प्लेस कर. What is the action plan of the government to reduce the referrals, especially in the private hospitals? मुरचे 71 private hospitals are referrals कित्या लागून धाडली ती तुका आहा. ते मिटिगेट करता जाल्यार त्यो फॅसिलिटीज तुवें सावथ गोवा तुवें रेडी करपा जायो. केन्ना रेडी करतलो आनी कितकोन डेडलायन दितलो हें तुवें आन्सर स्पेसिफीक एक प्लॅन करून सांगपाची गरज आसा.
बिकॉज सर ऑनरेबल मेंबरान जे विशय काडला रेफरल, आय अग्री विथ यू. रेफरल आज तुमी जेन्ना कोर्टान आमकां जे डायरेक्शन दिल्लें त्या कोर्टाच्या आदाराचेर वी हॅव ऑलरेडी स्टार्टेड द ICU फॅसिलिटी इज देर. इट इज एट फूल कॅपॅसिटी एट द मोमेंट. Referrals happens many times when you require tertiary facilities, and because of tertiary facilities we have to ensure that because of which people are being shifted to the Goa Medical College. And I do agree, I am not denying on the floor of the house, tu je sangta te sarke asa, पण तरी बी 70-75% patients are treated in the South Goa District Hospital. 25 to 30% of the patients are shifted from South Goa District Hospital to the Goa Medical College for tertiary care. And what you are saying is that just plain referral is taking place to Goa Medical College. That is not the case. I was actually, there is a question here asked by Bab Viresh Borkar on the referrals itself, and from he's asked a general question on GMC from Asilo Auspicio. But what I want to tell you is that unless we have these additional specialties put there, to some extent these referrals are going to continue, and that is that onus lies on us as a government to see that we put these specialties in place.
What you are saying that ICU is functioning is not correct. I would want a specific assurance before the 7th of August. Can you please give an assurance to come and inspect the South Goa District Hospital on the floor? Oh, assurance di tu yo tu choy and magi oloya before 7th of August.
Because sir, before 7th August opposition चे सगळे जे सावथाचे जे मेंबर जे येवंक सोदता इन्स्पेक्शनाक हांव एक मिटींग आपयता, तांकां आयजूच तारीख दिता आनी मागीर हांव मुख्यमंत्री घेवन ब्रीफ करता. सेशन जावपाचे पयलीं हांव येता.
बरें.